Emergency rooms packed as summer shoved away for the flu season. Now the crush is making hospital emergency departments busier this fall than they were at the peak of the COVID-19 pandemic. And all of it is straining hospital staff and increasing wait times. WMAR 2 News' Abby Isaacs puts the issue in focus for us tonight, laying out why it is happening and what's being done to address it.
ER nurses are asking for people to be patient as they see more patients with less staff.
We have nowhere to put anyone.
It's the perfect storm of COVID-19, RSV, the flu.
Marylanders are back on the move, and they are getting hurt and they are getting ill.
More patients, less nurses.
We have high vacancy rates.
Longer wait times.
We can have 30 or 40 more patients in the waiting room.
When that happens, hospitals use the Maryland Institute for Emergency Medical Services Systems, or MEMS, to let EMS personnel know just how crowded they are. A yellow alert means they're particularly busy. A red alert means they have no more inpatient beds.
The hospitals are trying to message to the EMS clinicians that if they have an option to take a patient to a different facility, that might be in the patient's best interest in terms of timing and the availability of care in the emergency department.
This September to mid-October was more than 4 times busier than the same time period in 2019 and 2020. Area hospitals were on yellow alert for 14,000 hours and red for 8,000, compared to 3,000 and 1,000 in the falls of 2019 and 2020. This fall was also busier than the peak of COVID-19 hospitalizations in January of this year. To help with the constant alerts, MEMS created a coordination center to transfer patients between hospitals.
We can call them and say, hey, we have this really sick person. We don't have anywhere to put them. And they know of all of the ICU beds throughout the state, and they can help us place people. And they've just recently started doing that with kids too, because our pediatric numbers are going up.
Baltimore ER nurse Lena Such says this is helpful, but more needs to be done because with 2,600 nursing vacancies statewide, they're getting burnt out.
They have compassion fatigue. There's high rates of PTSD in the ER, high rates of workplace violence, and it's just getting dangerous not having enough nurses.
President of the Maryland Hospital Association, Bob Atlas, says hospitals are trying to fill vacancies by offering retention bonuses, increasing minimum wage, or using travel nurses.
And that cost is considerable and has really risen to almost an unsustainable level.
Staffing has become such an issue that some hospital systems have again scaled back on elective procedures, a step that others may need to take as the flu season really picks up. Such says people can help by staying home if they're sick, wearing masks, and taking care of their chronic issues.
People who can generally go to an urgent care or try and follow up with their primary care doctor is really important because we can't fix everything.
And above all, understand they're doing their best.
The best thing that people can do is just be patient with us.
Governor Larry Hogan announced emergency legislation earlier this month to make permanent the temporary liberties he gave to hospitals to address the staffing shortage. We have more information about those changes on our website, WMAR2news.com. In Baltimore, Abby Isaacs, WMAR 2 News.
With us online for updates on top stories and breaking news, also for news and weather while, let's say, you're cleaning out the pantry. Download the WMAR 2 News app in the App Store. You can watch live radar and get breaking news sent right to your phone. Thanks for watching.
This WMAR 2 News update is sponsored by Jones Junction,